Hello and welcome to Formosa News. I'm Ian Kavat.
And I'm Karen Chen. Our top story today. Taiwan has added a fifth local case to a COVID cluster at Taoyuan General Hospital. The latest case is a nurse in her 50s who had worked in the same ward as a doctor diagnosed last week.
The health minister says the cases in this cluster are displaying faster transmission and shorter incubation periods compared with what Taiwan has seen before. Tight new controls were placed on the Taoyuan Hospital on Monday as officials raced to contain the outbreak.
Today, we have patient number 863, a nurse who works at the same hospital as patient number 838. She was tested on January 12th and the result was negative. She developed a stuffy nose and a cough on January 14th and 15th. Since she was a contact of patient number 856, she was tested again and diagnosed with COVID today.
In the course of 1 week, the cluster infection at Taoyuan General Hospital has grown to involve 5 medical professionals. The CECC has launched 6 response measures.
In response to this hospital cluster, we have launched the following precautions. First, CECC staff will be stationed at the hospital, forming a command post that is directly responsible for communication, coordination, and liaison with the CECC. Second, we are closing the hospital ward that the confirmed patient had been active in. We'll clear out and disinfect the space and only reopen it after environmental sampling shows that it's safe. Third, the affected floors will be cleared out and entry will be severely restricted. Fourth, experts will go in to give guidance and assistance on implementing COVID prevention measures in a hospital. Fifth, patients will only be discharged and no new patients will be admitted. Visits are forbidden and only one private caretaker may accompany each patient, and care workers must provide their real name. 6. We will encourage hospital staff to conduct self-health management. If they experience mild symptoms, they will need to report them immediately and not seek medical care on their own.
Compared to last year's hospital outbreak, this one has sparked a much stronger reaction from the CECC. Health Minister Chen Shih-chung said the new cluster was more concerning than the last.
Over the past few days, the outbreak has developed at a much faster pace than what we've seen before. The time from exposure to symptom onset is actually quite short, just 2 or 4 days. This timeline is obviously shorter than what we've had in our past experience, so we are a little worried. With such rapid transmission, we need to move even faster. We're hoping to improve administrative efficiency to tighten our controls on the epidemic.
The in-hospital command station will be headed by CECC official Victor Wang. He was at the hospital to establish protocols on Monday in hopes of bringing the outbreak to a swift and decisive end.